Good morning and welcome to the Alabama Way. I'm Comedienne JOY. This morning we are talking about kidney disease and how do you know if you have it, issues, and what can you do and have a good quality of life if you have that particular disease. And joining me now is Mr. Harry Giles. He's a nephrologist and you're with Trinity.
That's right. That's one of our hospitals that we go to.
Okay. First of all, now nephrology, that was a huge word. I ended up learning what it meant when I was a caregiver for my mother. So for some of the viewers that may be watching, tell us, what is a nephrologist? What all do you do?
Okay. Well, a nephrologist is a medicine specialty from internal medicine. So like your general internal medicine doctor, we would have all had that training. And then some of us have gone on to do further training in kidney disease. Much like a heart doctor is a cardiologist, they do further training. And we deal with kidney problems, mainly with kidney filtering problems, people that eventually need dialysis, or trying to keep people off dialysis and keep them healthy.
Gotcha. Now let's talk about dialysis, because we have seems like a growing population of people needing dialysis. Do you know why this is?
Yes. Up until the last few years, we've actually stopped putting more people on each year. So it's leveling out, the number of people going on dialysis for the first time. But what's happening is in the last 10 years or so, people on dialysis already are living longer. They're getting better care, we presume. They're having less heart attacks, strokes, and infections. So the population is growing, even though the number of people being started, for instance, this year compared with next year, is probably going to be about the same. They're just living longer.
Gotcha. Now let's kind of talk about that whole process, because I've kind of learned some things either through reading or asking questions as I meet dialysis patients. When a person is put on dialysis, we know that it's a cleaning of the process, but kind of walk some of us who may not be as educated to know what's that process. Okay.
There's two main paths to starting dialysis. The most common path is for people to go to a dialysis unit and do hemodialysis. And they sit in a chair in a center and they do dialysis usually about 3 times a week. Mm-hmm. And while they're sitting there, they either have a shunt in their arm where blood is removed and returned via second needle, or they have a dialysis line in a vein, usually in the neck, and blood is brought out of that and returned through that. And it takes about 4 hours to undergo that procedure 3 times a week.
So when they're going through this process, I heard 1 or 2 patients say that, hey, I'm wiped out, I had my dialysis treatment today. What are some of the side effects? What do they actually go through?
Okay, a lot of people don't realize this. You know, if you go get an x-ray, you just smile, they take your x-ray. It doesn't hurt. You don't get winded from that. When you do dialysis, you can actually burn up to 300 extra calories because waste is leaving your body, fluid is often being removed, and there are shifts of all that around your body as it comes out of your body. And it actually takes some energy. So a lot of times patients will report they're tired the next day or that evening. And that's not very uncommon at all.
So what other side effects that people may, experience?
Well, because dialysis is an active procedure, if people often will already have pre-existing heart disease, so there's concerns about heart rhythm problems. Your blood pressure can run low after dialysis. Sometimes you need to take it easy. Don't stand up quickly. And there's a slight risk of infection associated with undergoing any procedure, including dialysis.
Okay. And how do you determine, you mentioned earlier there are 2 ways you can get it in the neck or the IV. How do you determine which is best?
Well, the best way to do hemodialysis, and we'll talk about the other form, the best way to do hemodialysis is with a shunt because there's no plastic involved. These dialysis lines are placed when we don't have another way to do dialysis, and they're put into a vein. And unfortunately, that's an opportunity for a bloodstream infection, which is a serious thing. So my specialty has been working over the last decade or so to really try and reduce the number of people who dialyze that way. It's much preferable, and patients do better and have a better quality of life if they have a shunt created by a surgeon and can dialyze that way.
Now, you mentioned that dialysis patients are living longer. In the past, what was the expected rate to live, and then what's the expected rate now?
Okay. We've probably added 2 to 3 years on to every decade of life for people on dialysis. People in their 40s or 50s are now living on average of about 9 or 10 years on dialysis. People that are a little older in their 60s, maybe 6 or 7 years. And of course, as you get into your 70s, you're not expected to live as longer because of other issues as well. But those folks are still living an extra year, year and a half longer than they used to. So it's across the board improvement.
And so let's talk about quality of life. You kind of mentioned that word. what kind of quality of life should a dialysis patient expect to have?
Okay. Well, for dialysis patients going to a dialysis unit, a lot of patients won't be fatigued. That is somewhat dependent on your own medical problems in addition to kidney disease. You can still travel. You can set up a place to go do dialysis if you go to the beach. You can go down there while you're going. You can go on a cruise. To some degree, your quality of life also is contingent upon what other health problems did you have before you even started. Now, an additional way to have a good quality of life on dialysis is to do dialysis at home. And I'm actually our home director for that kind of dialysis. Mm-hmm. And I'm a big proponent of that. And I think if you go and you talk to kidney doctors, or actually doctors in general, and ask them what would you do if you needed dialysis, we would do dialysis at home because you have more freedom.
So kind of walk us through that process, because I guess in my mind, again, you know, I haven't been through that, but, you know, just knowing this information and maybe some of our viewers, but I would think that I would have to be medically trained or go to have the certificate, but then you're telling me I can just do this at home.
Absolutely.
So tell us how you would do this at home. What's
Absolutely.
that process?
All right, we've got about 150 people right now doing dialysis at home. And you don't have to be an engineer. You don't have to be a doctor or a nurse to do it great. Do a very good job. Most of our patients do dialysis at home. They're doing peritoneal dialysis. A soft tube is put into the belly, and when they're out walking at the shopping mall or whatever, they have it coiled up under their clothes. You don't even know they have it. And most of the time it's at night, although you can do it during the day. At night they hook up to a machine, and it puts fluid in the belly, and it drains back out. It takes waste with it. It can take extra fluid. And you can do that 4 or 5 times at night on a cycling machine, disconnect and go about your day. You do need to do that every day.
So if you do it at home, it's every day as opposed to the 3 days a week at a center. If
you do peritoneal dialysis, you do need to do it every day, but it's a little gentler because of that. If you can actually do hemodialysis at home too. Now I will tell you that training is a little bit more involved. That's about a 3-week training course to do that. You need to have a spouse or a person help you with that. Peritoneal dialysis, though, we usually get people trained in about a week. Okay. It just takes about 5 days, and they're ready to go. And then we support them for the remainder of that time.
And let's talk about side effects with that. Are there any side effects when you do it at home?
Yeah, with any form of dialysis, you can get a little excess fluid, may not be getting it off properly. We'll have to work with the patient. On the other hand, some of our patients occasionally get a little dehydrated, and we have to tell them to drink more fluid and don't be so successful with the dialysis. And there's a slight risk of infection associated with peritoneal dialysis, but it's very treatable. Okay.
Now, let's talk about kidney disease. Okay. Because that is what gets people to come to see you.
Yes.
First of all, how can we protect our kidneys?
Okay. The biggest things you can do to protect your kidneys are to try and treat or avoid the 2 main causes. Diabetes. Take good care of your diabetes, you probably won't need me. If you have high blood pressure, that's the number 2 cause of people being on dialysis. Control that, and you'll pay dividends. You won't just avoid me, you'll avoid the heart doctor and some other doctors as well. And then other things you can do, it does pay to stay hydrated. You do want to avoid being dehydrated all the time. And then exercise. We know it helps in so many other ways. It's been proven now to help kidney disease and reduce the risk of kidney disease. Also, one final note. The biggest medication you can take that can hurt your kidneys are the anti-inflammatory drugs like ibuprofen, naproxen, Celebrex, Mobic. Those medications, if you take them regularly, can cause kidney damage. And for people out there that are on those medications regularly for reasons, they do need to have their kidney function monitored just to keep an eye out for that risk.
Interesting. So is there an alternative for those patients taking those medications that maybe they can take something else?
Well, one option, as I said, is just to watch them, check their blood levels of things that we can see that are affecting their kidneys. And if they're doing fine, they can stay on them. The other option is to take Tylenol or to go see specialists within the field that you're involved in. Say if you have rheumatoid arthritis, see if there are other drugs that can be chosen. That's a little more technical of an issue, but you want to go to your specialist and seek out options if you're having some trouble from the anti-inflammatory drugs.
Wow, you've just slapped my hand 2 or 3 times on a couple of different areas. Doing good on the exercise, but you know sometimes your joints ache, and so
Yes.
you need some of those medications. We're going to take a quick break, Dr. Giles, but when we come back, we want to talk about some myth versus some facts about kidney disease. So stay tuned.